Welcome back, everybody, to another deep dive. You guys know the drill. You send us something that makes you go, and we dive into it.
That's right.
And today's dive comes courtesy of you. You sent us in a medical thesis all the way from Iran, and it's about using CT scans to measure,
Wait for it.
the diameter of the mid-rectum in trauma patients.
Yeah, it sounds a little out there.
It definitely is thinking outside the box.
It is.
So the researchers wanted to see if this could be a brand new, easy way to figure out just how bad a trauma is.
Exactly.
Now, this was a cross-sectional study that was done at the Half-Tier Hospital in Tehran, and they had 77 patients. We're talking blunt and penetrating trauma.
Right, a mix of everything.
Car accidents, falls, they even had assaults in there.
Yep, so a pretty wide range of mechanisms there.
So help us understand this a little bit better.
Sure.
What's the logic behind looking at rectal diameter in trauma patients?
Well, the mid-rectum is right there in the pelvis.
Okay.
And it's fixed in place. So the thinking is that any kind of trauma that impacts that pelvis, like a fracture or internal bleeding, could maybe also affect the diameter of the rectum.
Okay. That's actually more logical than I was initially thinking when I first read this abstract.
Okay.
So how did they actually measure this? Were they using like a special rectal ruler?
No special rectal ruler.
Okay.
They just used CT scans,
Okay.
which are already the standard for assessing trauma.
Right.
And so they just looked at the CT images
Uh-huh.
and measured the widest point of the mid-rectum.
Okay, that makes sense.
Yeah,
So
yeah.
they have their measurements.
Yep.
What did they find? Was there a connection between rectal diameter and how bad the trauma was?
That's where it gets interesting.
Okay.
They did not find a strong connection between rectal diameter and anything.
Oh.
No link to gender, the type of trauma, vital signs, or even how bad the injuries were.
Really? So no easy way to tell how badly somebody's hurt just by looking at their, Well, that's science for you, right? Sometimes you get a clear answer, and sometimes you just end up with more questions.
Absolutely. And it's important to remember that a single study doesn't tell the whole story.
Right.
Plus, the researchers were very upfront about the limitations of their study.
I mean, that's always a good sign, right? They're not trying to oversell anything.
They're not trying to hide anything.
So what were some of those limitations? Could those limitations have played a role in these kind of surprising findings?
I think, so for one thing, the sample size was pretty small.
Okay.
77 patients is a decent place to start.
Yeah.
But you want a bigger study
Right.
to be more confident in the results.
For sure.
Another limitation is that they had a really wide range of trauma mechanisms,
Okay.
which makes it hard to isolate what's specifically affecting the rectum.
Right, because a car accident might affect the body in a different way than, say, a stab wound or something.
Exactly.
And so all those things are getting kind of lumped together.
Those all together.
Okay, so that's a good point. And then, we're all a little bit different.
Right.
So did they take into account just the normal anatomical variation between people?
Yeah, that's another limitation.
Okay.
Everybody's anatomy is a little bit different. So those variations could have played a role.
Mm-hmm.
Then there's also the potential for just measurement error
Right.
with the CT scans themselves.
Even though it's a very precise tool,
Yeah,
it's still done by a person.
exactly. There's still a human element.
Yeah, that's a really good point. I hadn't even considered that.
And then there's a factor of time.
Okay.
The body's response to trauma, that changes over time.
Sure.
So depending on when they did the CT scan,
Mm-hmm.
that could have influenced the results.
Right, so if you measure it immediately after the trauma, that's going to be different than if you measure it a few hours later.
Yeah, exactly.
So a lot of variables to consider. But even with these limitations, I bet we can still learn something valuable from this study, right?
Oh, absolutely. Even studies that don't find a clear connection, they can still move our understanding forward.
So how does this study, with its lack of a clear answer, how does that actually move our understanding of trauma assessment forward?
Well, for one thing, it shows us just how complex trauma really is, you know?
Yeah.
We can't always expect to find those simple, easy-to-measure markers that tell us everything we need to know.
It's a good reminder that the body doesn't always follow a predictable script, especially after, something as traumatic as a car accident or a violent injury.
Right. And so this study, it makes us ask better questions.
Okay.
Instead of asking, is rectal diameter a reliable marker of trauma severity? Maybe we should be asking, in what specific circumstances might changes in rectal diameter be clinically significant?
So refining our focus and getting more specific with our research questions.
Exactly. And maybe instead of looking for one single marker, we should be thinking about patterns,
Okay.
Could a combination of subtle changes in rectal diameter along with other factors, could that be more informative?
That makes a lot of sense. It's like looking at the whole picture, not just one isolated detail.
Right, and this study also just kind of emphasizes how important it is to be transparent about the limitations in research.
Yeah.
These researchers were upfront about the things that might have affected their results, and that helps everyone interpret the findings accurately.
Yeah, it also paves the way for future research to build on what they've learned.
For sure.
Speaking of which, what kind of follow-up research could build on these findings?
Well, a larger study, for one.
Okay.
More patients would give us a clearer picture of whether this lack of correlation is really there.
And what about looking at specific types of trauma instead of lumping them all together?
That's a great point. Maybe rectal diameter changes are more meaningful in certain types of injuries.
Right, because a pelvic fracture might be different from a gunshot wound to the chest or something.
Exactly.
Yeah.
It would be interesting to see if rectal diameter is more predictive in, pelvic fractures, for example, or spinal cord injuries.
You mentioned spinal cord injuries earlier.
Yeah.
And that got me thinking.
Yeah.
This study didn't specifically look at spinal cord injuries.
Right.
But could there be a connection there?
It's definitely an interesting question.
Yeah.
Spinal cord injuries can interrupt nerve function,
Right.
which could then affect the muscles and tissues in the pelvis, including the rectum.
So maybe rectal diameter could be a useful indicator in that specific
It
population.
would be, yeah. Definitely needs more research.
It warrants further investigation.
I agree. And along those lines, it'd be interesting to see how the timing of the measurement affects the results.
Okay.
Maybe measuring it right after the trauma gives different information than measuring it a few hours later.
Right. Because the body's response to trauma,
Yeah.
it evolves over time. It's not a static thing.
Exactly. So there are definitely many avenues for future research to explore. And, sometimes those unexpected findings, the ones that don't give us a clear-cut answer, those are the ones that actually spark the most interesting new questions.
It's like those negative results are actually pointing us in a new direction, opening up a whole new path of discovery.
Yeah, that's a great way to put it. This study might not have given us the answer we were hoping for, but it's moved the conversation forward and opened up a whole world of new possibilities.
It's a good reminder that science is a process, not a destination.
Absolutely. And this study, even with its limitations, it's added valuable information to our understanding of trauma.
So as we wrap up this deep dive into the world of rectal diameter and trauma, what's the key takeaway for our listeners?
I think the big takeaway here is that it's just more complicated than it might seem at first glance. We can't always expect to find these simple, straightforward answers in medicine, especially when we're talking about something as complex as trauma.
Yeah, it's a good reminder that we need to kind of embrace that complexity and be willing to challenge our assumptions.
Definitely.
Sometimes the most valuable insights come from the studies that don't give us, those really clear-cut answers that we were kind of expecting.
I agree, and it's what makes medical research so fascinating. It's this constant process of discovery.
Right.
And even the studies that don't find what they were initially looking for, those can still push the field forward.
This whole discussion has got me thinking about just how we approach trauma assessment in general. Seems like we're always searching for that one perfect indicator.
Right.
That magic bullet that's going to tell us everything we need to know about how the patient's doing.
Yeah, I think that's a natural human impulse.
Yeah.
We want clear, definitive answers, especially when we're dealing with something as urgent and potentially life-threatening as trauma.
Right.
But the reality is the human body is so complex, and trauma responses can vary so much from person to person.
So maybe instead of searching for that one perfect marker, we need to shift our focus to understanding the bigger picture. Like you said earlier, looking for patterns and considering a combination of factors instead of just getting fixated on, a single measurement.
I think so. It's about using all the pieces of the puzzle.
Yeah.
Not just relying on one.
Right.
And that includes things like clinical judgment, the patient's history, and multiple diagnostic tools, not just rectal diameter.
Right. It's about putting all those pieces together to get the most accurate picture of what's going on.
Exactly.
So even though this study didn't find a clear connection between rectal diameter and how bad the trauma was, it still contributed a valuable piece to that puzzle.
I agree. It challenged our assumptions. It made us ask better questions, and it's opened up new avenues for research, which is always a good thing.
And it's also a great example of how medical research is such a collaborative process.
It is.
This one study from Iran has now sparked a discussion that's extending to our listeners all over the world.
Yeah, and it highlights the importance of sharing research findings.
Right.
Even the unexpected ones, because you just never know who they might inspire or what new questions they might spark.
Well, on that note, I want to thank you so much for diving into this fascinating and slightly unusual topic with us today.
Oh, it's been a pleasure.
And a huge thank you to you, dear listener, for sending us this study and sparking this deep dive.
Yes, thank you.
Remember, it's your curiosity that drives these conversations and keeps us all learning and exploring together.
So keep those questions coming.
Absolutely. We're always excited to dive into the next fascinating topic with you.
Always.
And who knows, maybe one day rectal diameter will be a standard part of trauma assessment. But until then, keep learning, keep questioning, and keep diving deep.